Hey guys, hey, we're gonna go over the shoulder real quick. Sorry, I'm just not getting back to you on this. Obviously, these are strange times, and I have a soccer ball and everything else behind me because I'm in my garage, and I'm isolated in quarantine. Real quick, if you're looking at this shoulder, I've got the PowerPoint right here. Sorry, I know I'm not really technology advanced right now because I'm totally winging this, but if you look at slide number 3, the biggest thing I want you all to understand is the anatomy of the buildup of what we're looking at as far as when we rule out a fracture. That's the first thing I always told you all is any kind of injury, you rule out fracture first. The biggest thing to get fractured is your SC joint. You can actually see it right here. It's these two little knots, and if you follow this bone, this is your clavicle, all the way down to make your AC joint. Anytime somebody falls on their shoulder just like this, the first thing to go is either their clavicle is going to fracture right here, which I'll explain more to you on Thursday, but the biggest thing we have to palpate first is your SC joint because that can break and go into your lungs. It's where a lot of people misdiagnose this. They're sitting there gasping for air and they're like, well, what's going on? It's your actual bone sticking into your lungs and they miss it. Okay, going real quick, just assessing the shoulder complex just on this PowerPoint. Like I said, the first thing you want to rule out is a fracture. Second thing you actually want to rule out is a dislocation because this is the one joint that actually gets dislocated more than most. So you want to make sure that everything there is anatomically correct. Okay. Also, make sure that there's feeling, that they have all nerve feeling. And then we can also do manual muscle testing. Obviously, I told you about that in the middle or the beginning of the semester. Manual muscle testing is really great when you're looking at the shoulder, but however, I'm not there to teach you guys this anymore. So if you guys, maybe when all this blows over, if you all ever want to stop by the gym or something like that, I can show it to you. But those are the biggest things that we want to rule out first. Remember, pain is subjective, and then we're going to start our special test. Okay, on your first special test, I've got my wife Andrea here behind me. We're going to look at the apprehension test. You will do this test if you see an athlete or a patient come into you and they have a history of shoulder dislocations or subluxations. I want you all to understand that dislocations and subluxations are two different things. Subluxation means that they have a history of it coming out of the socket and then it goes back in. So we physically can't see that. We just basically have to take their word for that. So this apprehension test will basically say, okay, they are telling the truth. Their shoulder is weak, especially the rotator cuff muscles around it and maybe a labrum. So what you're going to have them do is you're going to have them extend just like this. And you just stand in front of him. And then you'll take it and slowly external rotate back until you can actually feel the head of this humerus pop out. That's what's positive. So you'll just take it all the way back, and it's called apprehension because they're going to get apprehensive about it, and they'll be like, stop, stop, stop right there. My shoulder feels like it's going to dislocate. Obviously, you're going to do that bilaterally. That's a positive test if your humeral head actually pops out. Okay, this next test, shoulder impingement. Impingement's one of those words, just like contracture that I told you with the hip, that doesn't mean a lot because it's like it can mean 1,000 different things. The reason why I'm showing you this special test is because when somebody says shoulder impingement, you have to say of what, okay? Usually it's of the biceps tendon right here when we're actually looking at going internal rotation. It could be of any kind of rotator cuff, but just make sure later on down the road that you understand that impingement has to mean something else. So when we're doing this test, this is kind of like a false positive test. It's sort of like that slump test I showed you with the spine. It's going to create pain whether or not you have an injury or not. So I just want to show you that what's going on here. So you're going to just like this. And then you'll internally rotate right here. You'll put them at 60 degrees, internally rotate here, and it's not going to feel good if you actually do this on yourself. And then you'll put them at 90 degrees right here, and then internally rotate. Again, it should be painful whether or not you have impingement on any kind of tendon or not. So just keep that in mind. Okay, this next test, supraspinatus weakness. That's what the test is called. You are testing for supraspinatus. It is your strongest rotator cuff muscle that you have. I personally think that just like the Trendelenburg with your gluteus medius, this is like the gluteus medius of your shoulder. Your supraspinatus tells you a lot. It's just like a manual muscle test. So what you're going to do, when I say that this is an empty can, picture yourself holding a can of Coke or something like that. This is our full can position. This is empty can position. Full can, empty can. On this test, you're going to be an empty can at 60 degrees. We're not at 90, and we're not at 90 here. It's 60 degrees, empty can position. Just like this, put them in 60 degrees. This isolates the supraspinatus, just like this. It's basically a brake test. All I'm going to do is I'm going to gently push down, and I'm going to see if there's bilateral strength on each side. Just like this. Don't let me push down. Good. If there is weakness on one side, then it's a positive test. Okay, this is where it gets confusing because you got to differentiate what's empty can and what's full can on these special tests. I'm now at the labrum tear, okay? Your labrum, there's 4 different special tests from these. This one's the best one. Your labrum is that little donut shape cartilage, almost like the meniscus that your humerus fits into your shoulder so it does not pop out. Obviously, over time, it can sit there and get disrupted, whether it's an acute injury or an overuse injury, and then actually get stuck. It does not have great blood supply, so it acts just like the meniscus does. So what we're going to do on this one is we're going to go into empty can position, but this time we're not at 60 degrees. We're right out in front of us. This locks the labrum right here in our shoulder, so when I push down, it's going to cause intense pain if it's actually torn because it's going to get stuck and almost crunched inside that joint, just like our Apley's compression test of the knee. So empty can just like this, and then we'll push down. She will have extreme pain if positive, so pain is positive on this test. Your next one is our AC joint sprain. If somebody, patient or athlete, falls on their shoulder, just like I told you, check for fracture of the SC joint. You follow this clavicle all the way down. Now you have your AC joint that sits right on top. A lot of times running backs, when they're carrying the ball like this, they'll fall on their shoulder, and these little ligaments right here will basically become separated. That's why it gets its name separation shoulder or separated shoulder, okay? So we're looking at the actual sprain. One, let me tell you something, laxity is not positive on this because the ligaments are so small, we cannot differentiate what's laxity and what's not. They're just extremely small. So we're looking for pain again. Pain is positive. We are in a full can position just like this. Not in an empty can. This is labrum. This is AC joint. We have now unlocked the shoulder. Now everything is going to be right here on top. And all we're going to do is slightly push down again. Pain is positive, and it should be localized right here on top of the shoulder. Okay, the last one that I'm looking at is our speeds test for biceps. A lot of times, depending on who we are, a lot of athletes will get biceps tendonitis. I have it, especially in your dominant shoulder. It feels like a knife is sticking in there. It's really not that big of a deal, but it can become a big deal, especially if you have an overhead athlete, okay? Trying to think, just make sure it's not on the non-dominant because it could be something else, some kind of either impingement or rotator cuff issue. So what this is called speeds test. You're going to sit just like this in anatomical position, and I'm going to hold my hand here while she's trying to come up. She's going to try to come up forcefully, speed, just like this, but I'm going to try to resist her. If it's positive, you're going to see isolated pain right here on the front of the shoulder. I usually count down. I put one thumb right here on the top of the biceps tendon, and 3, 2, 1, go. Good. I do it 3 times. 3, 2, 1, go. And last one. 3, 2, 1, go. Perfect. You would check bilaterally, make sure that there's no pain. If there is pain, pain is positive. It's probably looking at a biceps tendon. And then real quick, y'all, on this last slide here, I have this wing scapula. The biggest thing I wish I was in class to tell you this, but the biggest thing I want you to look at on this is what happens when you forget to work out your back. A lot of athletes, they'll do just a lot of chest, or they won't do anything at all. Over time, your posture will start slumping like this. And if you're looking at this slide, it's the last slide that I have on here, their dominant side, scapula, will start winging out. That's when we have bad news, because later on down the road when we're assessing postural issues, they're going to be sitting like this, or they're going to be sitting like this, okay? So that's the biggest thing that you want to look at. A lot of this derives from either A, they're not doing any kind of postural things like rows or robberies or something like that, but another thing is just like the gluteus medius of the hips, their supraspinatus is super weak, and basically over time they're just going to sit there and try to reevaluate their gait, whatever motion that they have in sport-specific activity. So I will be with you guys on Thursday. We're going to talk a little bit more about shoulder injuries. I promise you I'll try not to be in my garage this time. But thank you all. Email me if you have any questions.